distinguishedness. Tell me, how many people here have jobs or had jobs before they retired? A bunch? Quite a few. Well, thank you. Probably many of your employers were members of the Chamber of Commerce. We really care about health care. The Tucson Metropolitan Chamber of Commerce represents over 2,000 member businesses whose employees and their families number the tens of thousands. Health care is of the highest importance to all of us. Not only do responsible businesses provide benefits, including health care, to retain the very best workers, we realize a healthy workforce is a productive workforce. The Chamber strongly believes that health care should be provided through the free enterprise system. Affordability is a common concern to all employers, from the self-employed to major corporations. Statistics show that from 2000 to 2008, family health care insurance has doubled. That's pretty astonishing. Part of that increase has been shifted to private insurers in the form of a hidden health care tax. Do people realize you're paying that right now, a hidden health care tax? This tax is caused when government programs fail to pay health providers the full cost of providing health care. Hospitals and doctors are then forced to raise their fees to insurance companies, who in turn raise our insurance premiums. We heard about employers' insurance premiums going up and up. Federal government programs such as Medicare and Medicaid underpaid health care providers approximately $88.8 billion a year. In Arizona, the state health care system called Access only pays about 76% of the actual cost to hospitals. Proposed budget cuts may reduce that number even greater. The Tucson Chamber is part of a coalition of organizations that is lobbying the state legislature to take advantage of the stimulus funds that came that may be able to save some of those payments and reduce additional costs. Our suggestions to Congress is for Medicare and Medicaid to pay the full cost of providing health care to hospital and doctors. This will help reduce the hidden health care tax and that increase the cost of health insurance. If we're going to have a system where you have government pay, because I'm going to be going on Medicare pretty soon, and we have the government paying one, we have private people paying the other. There has to be a fair playing field where everybody pays the full cost. Tort reform on the federal level also will reduce health care costs. We believe that there is a direct correlation between tort reform, medical malpractice insurance rates, and the shortage of trained medical professionals. Thank you. You probably wonder where I'm getting all this information. Well, we have a healthcare committee made up of Bill Pike from Grondelet Healthcare is here. He'll write our policy. And we have many healthcare professionals on our committees that come up with our policies. And here's one that's very important that was mentioned before. The Chamber supports healthcare information technology. Health information exchanges help slow down the rapid growth of healthcare costs by reducing unnecessary or duplicate x-rays, laboratory tests, and medical errors. Local information exchanges are at final stages of development. A national system would improve the quality and efficiency of care by providing a clinical snapshot of a patient, including medical history and current health status at the time medical care is being provided. We recognize that privacy and security for patients is of utmost importance when information is being exchanged between health providers. Any change in healthcare must be done slowly with special respect to unintended consequences, especially during this critical economic time. The free enterprise system is what made America great, and I caution against moving too quickly. I want to give you just a personal example of healthcare provided in this town. I haven't been sick in over 20 years up until July. I never even got a cold. I run, I have a good diet, take care of myself. But in July, I was rushed to emergency room at Northwest Medical Center. And thank you, Paul Parisi, for running a great organization there. I went in on a Friday, I passed out, my blood count was below 6, and I guess that's pretty bad. They discovered I had colon cancer. I went in on a Friday, they diagnosed it that Friday. I was operated on that Saturday, and I was out the following week. I really don't want some board in Washington to determine when I get operated on. That should be